Okay, Dr. McDougall, you have a quorum.
Very good. Thank you, Ms. McLean. And it is 5 o'clock, so we'll call this meeting of the Durham County Board of Health to order at 5 o'clock p.m. on August the 10th, 2023. Are there any adjustments or discussions about the agenda that has been disseminated?
Mr. Chair, just only one adjustment.
Yes, sir.
Under item number 6, that presentation will be given by Marissa Mortarboy as opposed to Savannah Carrico.
Okay. Thank you. All right. Board, we have one adjustment. I'll entertain a motion to accept the agenda with that one adjustment.
Motion.
Second.
All right, it's been approved and properly seconded. Ms. McLean, I think we're ready for the question.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. Braithwaite, Dr. Orto,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio,
Yes.
and Dr. Glover. Thank you.
Thank you. All right. Hopefully everyone has had an opportunity to review the minutes from the June meeting. If there are any additions or corrections, I will entertain those at this time. If not, I'll entertain a motion to accept the agenda minutes, from the last meeting.
So moved.
Motion to accept the minutes.
All right.
Second.
It's been moved and properly seconded. We're ready for the question, Ms. McLean.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. Braithwaite, Dr. Orto,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio,
Yes.
and Dr. Glover. Thank you.
Ms. McLean, do we have any public comments this evening?
Not that I'm aware of.
None that you're aware of. Okay, very good.
Yes, sir.
Well, before we begin with our staff and program recognitions, I wanted to just pause for a moment. One, to welcome everyone back from hopefully a restful summer, but also to acknowledge someone who isn't here with us today. Attorney Brian Wardell is not with us today, and many of you know how he has served this board and the Durham, the county of Durham for several years with dedicated and outstanding service. He has taken, for those who don't know, has been selected to serve as the Pitt County attorney. So he has left us, I think he left us last week, August the 4th, and will be starting his new position as Pitt County attorney in the very near future. In his stead, for the time being, we have the Durham County attorney, Mr. Alan Andrews, here with us, and I guess he will serve as our counsel for the time being until a permanent replacement for Attorney Wardell has been named. So welcome, Attorney Andrews. We thank you for being here with us today.
Thank you, Mr. Chair. I appreciate that.
Yes, sir. Director Jenkins, we'll give you the floor for any staff and program recognitions at this time.
Well, thank you so much. And again, to this wonderful board, we say welcome back. Hope you enjoyed your summer respite. While it's a little different for me to do this, but I'd like to really give accolades, kudos, and thanks to my two deputies, Liz Stevens and Christian Patterson. For the most part, they helped this huge ship run smoothly. Most recently, they have taken on some additional duties, and I just want to publicly thank them. They don't get enough thanks, if you ask me, but the work that we do is pretty arduous, but they make it easy and they make us look good. And I just want to just publicly thank them for all that they do.
I'll echo that sentiment. Thank you so much.
Yes, thank you.
All right, so we'll move on with the item 6 of the agenda, which is the administrative reports and presentations. We have our county health rankings PowerPoint presentation that will be given by Marissa Mortaboy.
Hi, good evening. So like
evening.
Director Jenkins said, I'm standing in for Savannah Carrico. She was unable to be here. And so one moment to share my screen. And can everyone see that?
Yep.
All right, great. And so I'm going to present the 2023 county health rankings data. So this is a snapshot of the county's health data looking at a variety of factors. And so you can see on here that Durham County is and remains one of the healthiest counties in North Carolina. Since 2021, we've been in the top 10, and currently this year's ranking, we are 9th. So just one thing to keep in mind, you know, it's great to be in the top 10, and people say, well, we fell a couple of spots. So the most important thing, these rankings are by quartile. So within the top 25, there's not much difference, but once you move to other quartiles, like between 26 and 50, 51 to 75 and so on, that's where you see the larger differences. And most of the data that I'm going to go over is from 2020 in the county health rankings, because there's always a lag in data unless otherwise noted. All right, so just a little background. County Health Rankings and MRMATS is a program of the University of Wisconsin Population Health Institute. So this data is gathered each year, and this is for all counties across the country, and it's focused on equity. And so you can see on the right side of this slide, the framework they use for developing these rankings and calculating them. And so feature social determinants of health, things like income, education, employment, and how they attribute to health as well. And so how to use this data. And so collecting data on race for following health factors, you can see here. So low birth weight, infant mortality, flu vaccinations, child poverty, drug overdose deaths, and a number of others too. And so there's over 30 health outcomes. And so the database gives us an in-depth look into the outcomes to identify strengths and weaknesses. And so using this data allows the health department to make evidence-based decisions to eliminate health and social inequities in the county. And so just anytime that we're talking about data, we always make sure to provide context on reasons for disparities, because as I go through the slides, there will be disparities for the different indicators. And so we always make sure to provide context for that. And so, and these are due to systemic racism and other factors such as inequitable access to healthcare and including language barriers, lack of transportation, not having health insurance, and also history within the medical system and mistrust of the medical system. And all those things play into the reasons for disparities with social determinants of health. So looking at data from 2022, the American Community Survey, you can see the racial and ethnic makeup of Durham County compared to North Carolina. And so Durham County is one of the most diverse counties in North Carolina. So Black and African Americans, as well as Hispanic and Latinos, make up nearly half of the county's population. And so, and this is one of the reasons that makes Durham great, and also for our uniqueness. So looking at quality of life factors, you could see that there's not a lot of differences here between Durham County and North Carolina, except for the last indicator on the slide, drug overdose deaths. So you can see that Durham County is significantly lower than the state at 18 compared to 24 for North Carolina, and this is per 100,000. And so I do want to point out that this data is not disaggregated, but there are differences. For example, we know from Durham County EMS data that Black or African Americans have a higher proportion of calls related to overdoses. So focus on areas of excellence. You can see life expectancy in Durham County. It's a little over 2 years higher than North Carolina, which is great. But then as we dig down into the data by race and ethnicity, you could see stark differences. And so it's nearly 5.5-year difference in life expectancy for Black or African Americans in Durham County versus the white population. And again, going back to systemic racism is reasons for this. And in mortality, you can see that we have fewer premature deaths in Durham County, lower infant mortality rate, and a lower suicide rate than compared to North Carolina. And so just to, especially about infant mortality, because there's been a lot of focus on that within the health department and also the county, that our rate overall is lower than the states, but the difference in infant mortality between Black or African Americans and whites is nearly higher, 3 times higher in Black or African Americans. So, just looking into the data. And access to healthcare, Durham is known as the city of medicine, and for good reason. So the proportion of primary care providers is much lower in the state. So 1 provider for every 810 people in the county versus over 1,400 across the state. And then mental health providers, 1 for every 140 people in the county compared to 340 people in the state. And so, so this shows flu vaccinations in North Carolina. So Durham County is doing better than North Carolina overall, but you can see here that there are differences among racial and ethnic groups too. And this slide focuses on mammograms in North Carolina. So we're at the 43%, that's both for Durham County and North Carolina. And you can see, again, there's disparities with Hispanic or Latino populations and Asians significantly lower than Black or African American and white populations. And so Black African American is still lower than white populations in getting mammograms, but not as great as the other inequities that we've seen. And so some areas of improvement. So reducing with the goal to eliminate racial disparities in all health factors to improve health outcomes, reducing HIV and STI prevalence, reducing violent crime, food insecurity, drug overdose deaths, also the uninsured adults and children, and improving math and reading scores, and reducing the number of homicides. And so I just want to point out too that the health department and county have multiple efforts to address these areas and to ensure that all our residents can have optimal health and live their healthiest lives. And doing this through community engagement, equitable outreach, and using evidence-based interventions. So that is just an overview of the county health rankings and where Durham County stands. And so Savannah's information is on this slide. If you would like to contact her, she'd be happy to answer your questions. But if anyone has any questions now, I'm happy to answer them.
I have a couple of questions. And this is maybe not terribly important, but the 8 counties that were slightly healthier than Durham County, can you tell us some of those counties?
Well, I can tell you that Wake and Orange are definitely, they're usually in the top, top 2 to 3, Chatham. I could look to see what those top ones are, but our neighbors are usually the ones that are either ranked right above us or very close to us.
Gotcha.
And it tends to be counties that have more resources as well. So like Mecklenburg too is usually up there in the top 10.
Gotcha. Okay. I had another quick question, and this is a huge question, probably not enough time to answer, but it was spoken of several times in the presentation about systemic racism and the toxic stress that's affecting health in Durham County. I know there are so many different ways that we're looking to address that from the department and even in the county and in the city. But can you talk with us a little bit about some of the more promising measures that are in place to address this toxic stress from systemic racism?
Well, I know through the Partnership for Health, and I invite, any of the others on this call too, any of the other directors, anyone else from the health department, if they'd to speak up as well, because I know some about the initiatives, but I don't know them in great detail across the department. I can speak about the Partnership for a Healthy Durham. I know working on ACEs, adverse childhood experiences, and resiliency, and so actually training community members on that and trainings to be able to communicate and work with community members on that. So the mental health aspect of working on ACEs and resiliency, and I know Jess Bosquet with health education is also working on that too. And so mental partnership has a mental health committee, so working through that, and also thinking about some of our other initiatives too to address systemic racism and access to care, and working with community members, so working with partner organizations, but also working with our community members to develop those initiatives. And I know that's not very specific, but it's more about our approach of really doing authentic community engagement. So we're addressing what the community tells us through the health assessment process, and really to not just do Band-Aids or to, surface level, but really get down to those root causes and address things that are historic too. So we're also doing a lot of work looking at how our history and policies impact us today too. So really addressing those to make an impact. And I'll invite anyone else if they would like to share anything else about their efforts.
I'll just say, Mr. Chair and the rest of the board, we count it a privilege to be in Durham, be at Durham Public Health, because we've been championing racial equity work since 2018. And we do have a racial equity nexus team, in addition to the county's efforts to have an Office of Equitable Wellbeing, which also houses a racial equity officer for the entire county. And Durham County has truly been a trailblazer on this front. Marissa kind of touched on outside. Internally, I can say that our racial equity nexus team is active. One of the commitments that I made was for us to not stop and start and stop, to just keep going. And since I've been a public health director, we've done just that. It is our ultimate goal to have this racial equity groundwater training be a part of the orientation process. We're currently working on a strategic plan for racial equity for the entire agency. And then, of course, we also use funding to work with a consultant, Dr. Deborah Stroman, to help us to ensure that we're doing all we can internally and externally to promote racial equity in an effort to decrease this toxic stress.
Thank you. Thank you both for your responses. I see Commissioner Alam has her hand up, so we'll recognize her at this time.
Thank you, Dr. McDougall. Thank you so much, Marissa. This was a really great presentation, really informative. I had a couple of questions, and if these are things you need to gather information, feel free to let me know and you can send that to after. In follow-up to Dr. McDougall's question about the rankings, may or may not be important, but what were the two counties that moved from below us to above us?
I do not have that information right now, but I will look that up and I will make sure to share that with Rosalind to send out to the board too, because usually it's small changes. You saw that we went from 9 to 7, and we've gone from 12 to 9. So it's usually the same counties that are kind of just moving around year to year. But I will get that information.
And then the next question is kind of like a multi-part long question. So the areas were increased in service and care that moved us down two spots, or would you say that there were just other counties that had improvements?
So I,
Can you hear me?
yes, I think I caught the question. There was, seemed to be, an issue with the internet. It
Oh,
sounds
sorry.
like, what was the, I guess if you could repeat it, please. Okay, it seems like there's, some technical difficulty.
I think she's having internet
Question was, were there
connectivity. Yeah,
areas of
okay.
service?
Oh.
Oh, 1 second.
Okay.
He just asked that we come back to her. She's connecting to
Yeah,
Wi-Fi.
exactly. Do we have any other questions regarding the fantastic presentation we just, Mr. Gregorio, go ahead, sir.
Thank you, Chairman. Thank you, Ms. Mortaboy, for your wonderful presentation. Just out of curiosity, you mentioned, I believe it was 1 out of 350 or so was the ratio for a Durham resident to a mental health provider. Do you know what the national average would be? Are we above or below?
I believe we're below, but I will get those, numbers. And so that's one thing that has always been, an asset here in Durham County's amount of providers, but I will get you those exact figures.
Thank you so much. Certainly with behavioral health being such a major topic these days, it's always good to hopefully be on the rising trend of that ratio. So thank you.
Commissioner Alam, you want to give it another try?
I just dropped it in the chat because I think that might be easier.
We can hear you pretty well now.
Okay, but yeah, my question was this moving down 2 spots. I know it's not significant, but just wondering, was that resulted in due to like Durham County decreasing in service or care in certain areas? And if yes, what areas? Or was it a result of just other counties improving services in certain areas? And if yes, what areas?
Yeah, so I think I don't have the specific answer. I can definitely look at that as I gather the other information to be shared with the board. And so it's usually like a combination of both. And so, maybe there's some changes in some areas where we're doing a little bit not performing as well as the year before, but then other counties have improved. So I think it's a mix. And yeah, and again, and I know it's hard when you're looking at it like, well, we fell or we're not doing as well, but it's really like those quartiles. But I completely understand. And so county health rankings have told us that over and over, but it's just human nature is like, well, we're not in the top 10 anymore. What happened? But I will look at that information. It could be just small changes in both directions.
And I think, yeah, like I'm still, as the commissioner, really proud of our health department and all of our staff. I think more so I'm asking just because if there's areas that, we have fallen, like I know Rod knows that our board will always be supportive of trying to help you guys lift up those areas. So just wanting to be able to know if that is what's necessary. And my last question is, I really appreciate the breakdown I saw with the COVID vaccinations and stuff. We've been seeing that like overall Durham County and then like the racial demographics. Do we have like a breakdown of basically seeing how we rank amongst other counties in treatment and service to racial and ethnic minority communities and just at that level? So like,
and sorry, was that specifically around COVID vaccination?
no, that in general, like just seeing like how are we compared to other counties in closing these disparities?
That is an excellent question. And I'm writing it down and I will do some research on that as well.
Yeah, Commissioner Alam, that probably would be something that we need to petition the state on. in terms of, how we're doing overall as a county, as one county out of 100 counties. And we're happy to research that for you.
That'd be great. I always love to be able to show off Durham County leading the way.
And we have an excellent data team, so I will pose this question to them. And I do have the top 10. So thank you to Lindsay for pulling that up before I could get to it. So Wake is number 1, followed by Orange, Union, Dare, Camden, Mecklenburg is in 6, Watauga, Currituck, Durham in 9th, and then Terrell County is 10th. But I will work on getting the just where the changes have been in the last couple of years between counties. Yeah, thank you for all your thoughtful and great questions.
Thank you. We appreciate it.
Thank you.
All right. Well, we're moving on through the agenda. The next thing we have is item 7. We have our public health vacancy report for August of 23. I'll let I'm speaking into existence. Dr. Jenkins, we'll give you an opportunity to discuss this at all. What I'm seeing, and you can help me out, is maybe a slight uptick in vacancies from the end of June to the end of July, and I'm assuming that's due to resignations at the end of the summer.
Indeed, we still had remnants of the Great Resignation. However, for this great board, I'm proud to report that we are certainly on the upswing. And I don't know whether or not it's attributed to things kind of normalizing, coming out of COVID, the pandemic, I should say. COVID's still here, but we have seen a significant number of vacancies being filled within the last 2 months. The data is a little bit dated, but I can attest that we still track our vacancies and our hirings like hawks. We meet bi-weekly. There's a medical management team meeting, which we still look at vacancies. So it's something that we know that this board cares about. And from a big picture perspective, I know that the county wants to make sure that we fill positions as well. So still have some challenges with our school health team, to be very transparent. And that is, I have made that my top priority in terms of trying to make sure I can get those school health positions filled.
Okay, very good, very good. The next thing we have is our NOV report for August. It looks fairly standard, but this is where Attorney Wardell normally jumps in and makes a few comments.
We're fortunate to have Patrick Eaton here, and
Okay.
Patrick works hand in hand with, he worked hand in hand with Attorney Wardell. Patrick, we offer the opportunity for you to provide any updates.
Okay, thank you, Director Dickens. Good evening to the board. We have some new additions. There are a couple of removals, but it's kind of a steady state right now. Several of the addresses on the list are pending connection to public sewer. One of the issues is that the city's tap crews are about a minimum of 6 months behind just to get a tap installed. And we're also seeing on the septic installation side, there are some contractors that are reporting 14-month backlogs for new jobs. So, it's the labor shortage is affecting all aspects of our industry, not just here in the health department. But, I look forward to working with Attorney Andrews and addressing some of these older ones, but we've also got several we've been able to issue permits for that have been on there for a while, and they're pending installation. So I'm hopeful in the next 3 to 6 months, we'll see a big swing in the compliance rate.
Okay, thank you. Thank you. All right, moving on, we've got our health director's report. Hopefully everyone's had an opportunity to kind of look through that. If you have any questions for our director, the floor is yours. No questions? All right, all right. I don't know if I had a question, but I was certainly impressed by the one of the Dine projects, the summer series at the library, and the outdoor cooking lessons were very impressive. So hopefully, particularly with the outdoor cooking, the outdoor education and cooking camps, is there a plan to expand that? Well, I know it's at 2 schools right now. And it looks to me to be successful thus far. No early metrics here, but if it is indeed successful, is there a plan to expand it to more elementary schools?
I will certainly invite Rachel Elledge, who is our nutrition director, to expand on that. But I will say this: certainly are delighted that this work can happen primarily for 2 reasons, which were listed inside your package. Number one, the DIME program was the recipient of additional funding. That doesn't happen unless they're doing great work. So they now will have a full-time bilingual DIME educator, and we're delighted about that. Second thing that's near and dear to my heart is the fact that DIME was able to receive additional funds in the form of a grant from the North Carolina Public Health Association, which I happen to be the president. And that's primarily because of the great work that they've done, and they've been able to submit information detailing that great work. And I do believe, correct me if I'm wrong, Rachel, but you guys were the recipient of about $10,000 to be able to do that work. So I'm not going to steal her shine. Rachel, the floor is yours.
That's right, Rod. We do great work. That program does great work, and we are receiving additional funds for this year, enough additional funds to expand to with the bilingual position, and another part-time position that will help with some of the policy systems and environmental changes that program does. But to the original question, Dr. McDougall, we definitely plan to continue that programming, the outdoor programs. Those are primarily summer programs related to school not being in regular session. But during the school year, they do some outdoor things. But if you were referring to the camping programming, that will be done. It's about wrapped up for this summer, and then will definitely be happening again next summer. So does that answer your question?
So I'm glad to hear that it's going to be happening. There's a plan for it to occur again next summer, but I'm wondering, once you've closed out this summer and look at how successful it was, is there an opportunity to add another 1 or 2 schools? I don't know if the staffing will allow for that, but just wondering if that's a possibility.
Yes, you did ask that. I don't know that there are plans right now to add, but the staff is really good at looking at successful programs and then trying to introduce them to the other schools. You know, the schools, with those funds, the schools have to meet the SNAP eligibility requirements, meaning that 50% or greater of the school population is eligible for SNAP funds. So I'm sure that they will look to add it to other schools if the staffing allows. If
right.
This, yeah. Mm-hmm.
Okay. All right.
Yeah.
Thank you. That's yes, ma'am. Go ahead, Dr. Jackson.
Yeah, I'm just curious. So are there other counties in the state that have similar programs to what we're doing here with DIME in the school?
There are 9 programs. That's a good question. There are 9 SNAP Ed funded similar programs. They're not called DIME. DIME is the only program that is specific to Durham. Yes. it's Durham Innovative Nutrition Education Program. So it is, you won't find DINE anywhere else,
Right.
but there are some similar programs throughout the state that are funded with these same federal SNAP Ad funds.
Okay.
We do our program, I think, is the largest in the schools. Mecklenburg also has one, and theirs may be about equivalent, but other programs using those funds are not all done in the schools. Some of them are done in the community in other ways through 4-H or, but ours is one, if not the biggest, one of the biggest in the schools. Yeah.
All right, great. Yes, thank you for that.
You're welcome.
Dr. Jackson, I do know that Mecklenburg and Surrey County have a pretty robust program, but nothing compares to Durham.
I know, never.
Awesome. Thank you so much for your response, Ms. Elledge. So we're pressing on with our agenda. There are no committee reports and no old business on the agenda. For the new business, we have an environmental health fee change proposal. If everyone has had an opportunity to look at that, I guess if there's Director Jenkins, if you wanted to give us a little background or something, or we can just put it to a vote to approve it.
I will, if it's okay,
Yeah,
Mr. Chair, I'll just kind of give a little background and also run through the ratifications and the amendments, if that's okay.
sure, absolutely.
Okay. As mentioned, it's within your packet. Days after the board approved our department proposed fee schedule, the General Assembly passed Session Law 2023-90, which was House Bill 628. And what it pretty much does is it changed the regulatory activities and on-site water protection permitting requirements. So in turn, it wasn't just a Durham thing, just about every county had to in turn add these additional fees. So we're just pretty much complying with the law, and we certainly appreciate your consideration of that. The fees associated were included in your package, and again, this is something that thou shalt do, one of those must-dos from the General Assembly. When we turn our attention to the budget ratification, we had two for your consideration. The first was you were requested to approve an amendment to recognize $26,853 from North Carolina Department of Public Health Environmental Health Section led in the asbestos branch. These funds will support testing and remediation activities for lead in water and inspection of remediation for lead-based paint and asbestos in Durham County Public Schools and licensed childcare facilities requiring assistance from us. This is nothing new. This is something that we do all the time. However, increased funding has been allocated, and we expect this funding to run through December 2026. The second was a budget ordinance to recognize funds in the amount of $14,220 from NCDHHS Division of Public Health, Epidemiology, and Communicable Disease Branch. These funds are intended to assist us in meeting our STD service needs for our patients and provide a mechanism to award federal STD prevention funds to really bolster our 340B STD drug eligibility. So the drugs are used to reduce, of course, morbidity, mortality, and spread of STDs. This is what we do in public health. Those were the two budget ratifications. When we talk about the budget amendments, I apologize, there was one more I skipped. The board is requested to approve $29,000 from NCDHS Division of Public Health. There was some sunsetting of the state's community linkages to care for overdose prevention and response for about 3 months. So that was good news for us because, the county was in the midst of thinking about their opioid strategy, and we were like at a point where we didn't know what was happening because these funds were sunsetting. We got news that there was going to be additional 3 months. So it allows us to continue to implement our approved core strategies for community-based programs to prevent fatal and non-fatal opioid opioid overdoses. Try saying that several times. Moving on to the amendments, the board is requested to approve an ordinance to recognize $420,614 from NCDHHS, Division of Public Health, Epidemiology, Communicable Disease Branch. These funds are intended to leverage and build upon our existing epidemiology, laboratory capacity, or ELC infrastructure. And simply stated, these funds are going toward helping us continue to fight the coronavirus. So we're thankful for that. The board is also requested to approve a budget ordinance to recognize $461,250 from NCDHHS, Division of Public Health, Epidemiology, and CD Branch. These funds are used to expand CD surveillance, detection, control, and prevention activities, and also to address COVID-19 due to the public health emergency. And again, some additional COVID funds because we all know that COVID's not done. The board is also requested to approve additional funds in the amount of $98,702 from NCDHHS, Division of Public Health, Epidemiology Section, CD Branch. These funds are actually supplementing previously recognized funds that we received for fiscal year 24 in the amount of $98,427. So that now brings that total to $197,129. These funds are going to be used to create the approval to create 2 full-time CDCS. Those are the disease surveillance specialists. And again, all in an effort to mitigate the spread of communicable diseases. Finally, Mr. Chair and members of the board is requested to approve an ordinance in the amount of $1,857 from NCDHHS, Division of Public Health, Epidemiology Section, CD Branch. And this is an increase in grant funds to provide temporary funding to local health departments for tuberculosis active screening and treatment. And that is a result of us receiving increased caseloads from Ukrainian refugees and humanitarian parolees. And I'll also add, Mr. Chairs, that we have also been asked to assist Wake County in their refugee population. I think no good deed goes unpunished. That means that we're doing a great job. Wake is having some issues, so therefore they have asked us to assist Wake County. That concludes all of the amendments, ratifications, and the approval of the new fee schedule for environmental health.
Thank you, Director Jenkins. So we'll go ahead and put this to a vote one by one. We'll start with the environmental health fee change proposal. I'll entertain a motion at this point to approve those fee changes.
So moved.
Second.
All right, it's been moved and properly seconded. Any unreadiness? I think we're ready for the vote.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. Brightway,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
and Mr. Gregorio.
Yes.
Thank you.
Awesome. Next, we'll get to the budget ratifications, the 2 budget ratifications. I'll entertain a motion to approve those.
So moved.
Second.
Okay, again, it's been moved and properly seconded. If there's no unreadiness, we are ready for the vote.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. Brightway,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
and Mr. Gregorio.
Yes.
Thank you.
Thank you. And finally, the budget budget amendments totaling right around $1 million. 5 of them will entertain a motion to approve the amendments.
So moved.
Second.
All right, it's been moved and properly seconded.
Second.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. Brightway,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
and Mr. Gregorio.
Yes.
Thank you.
Awesome. Thank you. Thank you. We are almost done. Any informal discussion that we would like to have this evening?
Here, you want to make sure you ask about any agenda items for next month.
Absolutely.
Yes. For our next meeting, I'm always interested, I think the whole board is, for September meeting to get just first impressions about what the school nurses are seeing in the schools from the summer.
Okay.
More than happy to provide that update to you. Dr. Jackson.
Okay.
Any other requests for information to be shared at the next meeting?
I will check, Mr. Chair, I will check with our finance administrator. I do believe that you may be due for a quarterly update, but we'll just double check just to be sure. And yeah, we'll make sure of that.
And what's the date of our September meeting?
It would be
September 14th.
Thank you. Would that be a good time, Director Jenkins, to talk about lead updates?
More than happy to provide you with that update as well.
Thank you.
all right. Anything else that the board would like to hear presented at the next meeting? We have 3 items by my count.
That's good.
Right. Okay. All right. Well, if there's nothing else we want to see on the next month's agenda, I will entertain a motion reluctantly. I don't want to leave you folks, but I'll entertain a motion to adjourn today.
Motion.
Second.
All right. All right. I think we're ready for the question.
Dr. McDougall,
Yes, ma'am.
Dr. Wright,
Yes.
Commissioner Alam,
I'm not sure. Yeah.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. Brightway,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
and Mr. Gregorio.
Yes, and enjoy the rest of your summer.
Thank you.
I know one of these times somebody's going to say no.
I doubt it. I doubt it.
Look, the quorum overruled, majority overruled though.
Just to spice it up, somebody say no next time. No. Good to see everyone.